Imagine waking up to a world where every interaction could be fatal. Not just a virus that causes inconvenience, lockdowns, and mask mandates, but a virus 10 times more deadly than COVID-19. One where infection rates spread just as quickly, but the chance of survival plummets to a terrifying level. The headlines would be apocalyptic. Hospitals would collapse within days. Entire cities could become ghost towns. In our reality, COVID-19 has claimed millions of lives worldwide. But multiply the fatality rate by 10, and the stakes become almost unimaginable. In such a scenario, every cough, every handshake, every crowded subway car could carry the weight of death. Governments would not have weeks to prepare, they would have hours. The global economy, already fragile in 2020, would implode under the strain of mass casualties and panic. The human toll. Even today, the human cost of COVID-19 is staggering. Families torn apart, healthcare workers exhausted, funerals postponed or canceled, and mental health crises skyrocketing. Now imagine that on a scale 10 times worse. Communities would experience catastrophic loss in a matter of weeks. ICU beds would vanish overnight. Ventilators and oxygen supplies would run dry. People would be forced to make unimaginable ethical choices. Who gets treatment, who doesn't? The very concept of triage would become a daily reality for every hospital, everywhere. In this scenario, frontline workers would face a mortality rate far higher than any war zone in modern history. Doctors, nurses, and paramedics could become the largest vulnerable group, not just due to exposure, but due to the sheer numbers of critically ill patients overwhelming the system. Entire cities could see healthcare infrastructure collapse, leaving millions without care for even minor injuries or chronic conditions. Societal impact. Society would fracture under the strain. Fear would replace normal social interaction. Schools, workplaces, and public spaces would shutter almost immediately. Governments might resort to extreme measures, martial law, enforced quarantines, and strict travel bans. Economies would tank as supply chains fail, factories close, and markets crash. Even the most resilient countries would struggle to maintain order as panic spreads faster than the virus itself. Consider the psychological toll. Anxiety, grief, and survivor's guilt would dominate daily life. Communities would mourn mass losses, and social cohesion could erode as trust breaks down. Neighbors might avoid one another entirely. Cities could resemble abandoned zones, eerily quiet except for the sounds of emergency vehicles or announcements urging people to stay indoors. The global response. Vaccines would be humanity's only lifeline, but even with rapid development, distribution would be a race against death. Pharmaceutical companies and governments would face unprecedented pressure to deliver protection to billions, and the first months of the outbreak would define survival. Countries without resources to manufacture or distribute vaccines quickly would face catastrophic losses. International aid could become a matter of life and death, and the geopolitical landscape would shift as nations compete to protect their citizens. Borders would close, travel would halt, and global trade could collapse. Food security would become a pressing concern. Without functioning supply chains, supermarkets would empty rapidly. In wealthy nations, rationing might be implemented, but in poorer regions, famine and disease would compound the crisis. The virus would not just kill, it would destabilize society in ways we are only beginning to imagine. Individual choices in a deadly world. On a personal level, life would change overnight. Public spaces would vanish. Gatherings of any kind would be deadly. People would barricade themselves in homes, avoiding even minor interactions. Social rituals, birthdays, weddings, funerals would be postponed indefinitely, and technology would become the only bridge to connection. The virus would redefine what it means to live, to socialize, to work. Even basic human touch, long a comfort, could become a vector for death. Human behavior would adapt in unexpected ways. People might flee cities in droves, spreading the virus further, but seeking safety. Panic could lead to hoarding of supplies, civil unrest, and even violence. In such a scenario, governments would be forced to act decisively, and the balance between personal freedom and public safety would become the ultimate moral dilemma. Healthcare and science under pressure. Science would move at lightning speed. Hospitals would become experimental zones for treatments, and doctors might be forced to rely on untested protocols. Clinical trials, normally methodical and carefully regulated, could be fast-tracked to meet the urgent need for cures. Ethical boundaries would be tested. Do you administer an experimental drug to a dying patient? Do you prioritize treatment for younger or healthier individuals? Every choice could mean the difference between life and death, magnified by the scale of the outbreak. Technology could play a critical role. AI-powered predictive models, contact tracing apps, and global data sharing would become essential tools to manage and mitigate outbreaks. Yet even the most sophisticated systems would struggle to cope with the velocity and fatality of a virus 10 times more deadly than COVID-19. The psychological crisis. The mental health impact would be unprecedented. Anxiety, depression, and trauma would surge worldwide. Children growing up in this environment would experience a formative landscape dominated by fear. Healthcare workers would carry the psychological weight of mass death. Survivors would wrestle with grief and guilt, and communities would be fractured by loss. Entire generations could be shaped by the trauma of living under constant threat of death. Media coverage would be relentless. Every new case, every death, every overwhelmed hospital would be broadcast globally, amplifying fear. Social media would become both a tool for information and a weapon for panic, spreading rumors and misinformation. Governments and health organizations would have to battle not only the virus, but also the viral spread of fear itself. Lessons from history. History provides glimpses of how humanity responds to deadly pandemics. The 1918 influenza pandemic killed tens of millions worldwide, an already unimaginable number. Multiply that intensity tenfold in a modern, interconnected world, and the results are staggering. Globalization, air travel, and population density mean a virus could spread across continents in days, not months. Modern medicine might save millions, but the rate of death would still be catastrophic. The economic and social lessons would be profound. Entire industries could collapse, governments might default, and international cooperation could be tested like never before. In such a world, survival becomes not just personal but systemic, dependent on the collective actions of nations, scientists, and communities. A world transformed. If COVID-19 were 10 times more deadly, our world would not simply continue as normal with adjustments. Society, culture, and human behavior would transform radically. If this exploration of a world on the edge captivated you, hit like, subscribe for more deep dives into global what-ifs, and comment below. How do you think humanity would respond if COVID-19 were 10 times deadlier? Would we survive? And what would the world look like on the other side?